Hey, so this video is about how to navigate if you are being injured during breastfeeding because your baby is biting or chomping. So if that's happening to you, I want you to know first of all that your baby doing that, they're not doing it on purpose to try and hurt you. Chances are they're teething, their mouth feels kind of funny, and so biting down or chomping down on your breast and nipple, it just makes their gums feel better. But here's how to navigate that, because if they keep doing that, it makes breastfeeding kind of scary. We can get angry with our child. It's not preserving the breastfeeding relationship. So here's a couple of things that you can do about it. So thing number one, if you jump when you're startled, when you're bitten, you were probably naturally going to do it anyways, but you can emphasize it a little bit. Sometimes when babies realize, oh wow, the world shook when I did that, I don't like that, it causes them to stop. So you can just do a startled jump. You can say ow or no, using your voice to communicate that no, I don't like that. And you can even say those words, you need to stop, I don't like that. It doesn't matter how young baby is, you are laying out the foundation. And so, don't worry about, but they don't understand me. They can still associate that tone of voice and that set of sounds with, oh, this doesn't seem to be working out well. Maybe that's not a good idea. Maybe I shouldn't do that anymore. You can do time outs. If they bite you, then you can say, no, you need to take a time out. And you can set them down for 5 minutes. When they realize that I do something and then the breast was taken away, that can teach them that's a behavior that they should not repeat. It's something that they shouldn't do again. Escalating things a little bit. So this is taking a look at a broad range of cultural responses. So if this does not fit your cultural context, you don't have to use these tools. I'm just making sure that you know about the different options available to you. A physical stimulus can also help your child to realize that this is unwelcome behavior. So when they've bitten you or chomped at you, what you can do is give them a little nip on the cheek. So please remember, I am not saying to pinch. I'm not saying to harm or injure your child. Do not do that. I'm saying to nip. And what that means is that you're giving them a little bit of feedback. So even if you do it to yourself, it doesn't hurt, but you can feel, oh, well, it's not the most comfortable thing. Somebody's grabbing my cheek. You can give them a little nip on the cheek, and that indicates to them, I don't like that. Along with that, the act of doing that nip tends to pull the mouth out to the side, so it can break the seal. And so if they are trying to chomp on at the time, having their mouth pulled out to the side a little bit can make it feel strange enough that they open their mouth and let go, so you don't have to worry about them chomping and trying to pull back in that position. So if your baby is biting, again, it's not something that they're doing on purpose to try and hurt you. And if anybody has a baby who's biting you and then they're smiling at you and you are concerned, like, does my child enjoy hurting me? No, here's actually what's probably going on. For a baby who chomped and got the startled response, sometimes they actually think it's a game. So instead of startling them and making them stop, they think, oh, that was fun. And they think they're playing with you. So a baby who bites and then looks at you and smiles thinks they're playing a game, okay? They're not a little tiny psychopath, okay? Don't worry about that. Instead, just know that you have that range of responses, whether it's saying no, doing time outs, giving their cheek a nip each time that they do it. You have opportunities to give them that feedback that this is not a game for mom. This needs to stop, okay? And so with that, I hope those resources are helpful. And just know if you have been bitten badly enough that it broke the skin, it can take a little while for that to heal. Make sure that you're keeping the breast clean and covered so that it has opportunity to be protected from infection. And just know, awesomely enough, that one of the best protections against infection is just using your own breast milk. It's a great healing agent, a great preventative agent. So, and it came from your own body. How nice is that? But keep it clean, keep it covered until it heals. And ideally, you'll be able to jump right back into things and allow your breastfeeding relationship to continue. So I hope that is helpful. All the best.